I don't think we had any sense of magnitude that the virus would kind of take on over the last 2 years. But we did certainly feel like we were on the precipice of something.
Assumptions were that maybe we would reach some 100,000, like a few 100,000, and that seemed astronomical. I don't remember a single prediction that the United States would see 1 million casualties from COVID-19.
I think we've really failed as a society to see the pandemic as a collective risk that demands collective solutions. Now, as a result, we're seeing an enormous discounting of those deaths as somehow deaths that don't really matter.
It does take my breath away that we're soon to have a million people in 2 years who have died from this pandemic.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
As emergency medicine doctors, we are really trained to handle the unexpected. And with this particular virus, especially in March of 2020, we were really figuring it out. And so we didn't have the knowledge and the know-how. And the feeling that I had was hopelessness and helplessness.
There was a lot of compassion around that. There was a lot of focus on collective mourning. But as time passed, I think that what we also saw was a lot of this kind of compassion fatigue, and death went from being a collective problem to be solved to really being an individualized issue where we were sort of pointing fingers and saying you were vaccinated or not vaccinated.
Media coverage has really moved away from the horror, pain, and pathos of COVID deaths. It's tough from the perspective of news because the news around COVID deaths has been just more and more and more of the same. And so unfortunately, that has meant that some of the novelty and the shock and the concern has been worn down.
As we're increasingly accepting these deaths as part of the general background of preventable mortality, what we're seeing is a real kind of turning away from the commemoration of those deaths.
How do we begin to heal from the significant impact that this had, but also how do we begin to repair broken parts of the society that we live in that this virus really demonstrated to us?
In a lot of ways, I mean, local healthcare systems, there's this crisis still unfolding, but then at the national scale, it's sort of like we've moved on, a large percent of Americans are vaccinated, we're over this pandemic. And so I think that's been really, really hard as the pandemic stretched on to sort of make sense of and to figure out how are we going to move forward as a society.
There's been an effort to dedicate the first Monday of March as a national day of mourning, a national day of commemoration for those lost to COVID-19. That has remained stalled in Congress. I think that would, however, be a critical step toward recognizing the truly exceptional nature of these deaths.
We've seen more total casualties than any other country in the world. So that should be really shocking. This is not the normal course of events. We do not have to accept this. We have other choices.
One of the things that we can all do as individuals is to try to pause and to really remember that there is a story behind every statistic.
1 million lives is a huge number, but no matter what that number is, that number kind of means nothing in the face of individual loss of a loved one. It's been a tremendously difficult 2 years, and so showing some amount of kindness and patience, I think really will go a long way to rebuilding from the impact that COVID had.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.